Hi, everyone. Okay, so this is actually part two of week two. I did the intro PowerPoint. I would encourage you to watch that before you watch this one, because it gives you a generalized idea of what this particular treatment planning PowerPoint is about. And then, of course, care of the adult with ocular disorders is next, which gets into the nitty-gritties of each particular eye disorder. But this one in particular is about treatment planning. Now, in chapter 4, you learned about the art of diagnoses and the art of treatment that the nurse practitioner role really encompasses. So this kind of just talks about what the actual process is when it comes to the NP role in diagnosing and treating. Okay, so treatment planning. How do we develop a plan of care for our patients? Where does it all come from? Where do you even begin, right? So we have standards as NPs that help guide us when we do create our treatment plan. Okay, so what are our standards and what is the process of care? So the nurse practitioner, together with the patient and family, establishes an evidence-based, mutually acceptable, cost-conscious, effective plan of care that maximizes health potential or end-of-life decisions. Formulation of the plan of care includes diagnostics, pharmacological, non-pharmacological, patient education, referrals, consultations, and follow-ups. So diagnostics being your tests, your screening, your labs. Pharmacologic meaning, what are you prescribing? What kind of treatment are you going to offer? Non-pharmacologic could be other treatments that are not, don't require a prescription. It could be icing or using ice or using a heating pad or taking, any kind of holistic measures. Patient education, we are always going to be educating our patients and providing them with guidance to make the best possible choices for themselves. Referrals could be to any other particular specialist if whatever your symptoms that your patient is presenting with is out of your realm, and you've done all the basic standardized testing, and now it's time for them to go see a specialist. And consultations as well, same thing, referring out to get a second opinion from a specialist. And then, of course, follow-up, very, very important. You always want to follow up with your patient, have a follow-up exam, just to make sure whatever treatment you put in place is actually working, or if they need further education or further treatment, you can provide that then. Okay, so process of care required for treatment planning. So first things first, we're going to assess where the patient's at. What's going on with your patient? First things first, you want to obtain a comprehensive, relevant health, social, and medical history. Start from the top. What brings you in today? Have you had this problem before? What's going on at home? What do you do for work? What do you do for stress relief? What kind of history? Do you have anything in the past that I should know about? Any major surgeries? Any major illnesses? Anything in your past? Any major motor vehicle accidents, allergic reactions, that kind of thing. Talk to your patient. Just be friendly, be open, let them tell you, you may not be able to follow this guided particular assessment that, we usually have as our standardization, but you'll find things out when you're talking to them and just getting information through bits and pieces throughout your conversations. Obviously, you're going to perform a thorough physical exam based on their age and history. You're going to perform and order preventative and diagnostic procedures based on the patient's age and history. Remember, that goes back to your United States Preventative Task Force standardization. You want to make sure you're looking at what age bracket that your patient is in and what screening would be appropriate for them based on their age and history. And with that, you're also identifying any health risk factors. Does your patient smoke cigarettes? Do they use are they having any substance abuse issues? Do they drink excessively in terms of alcohol? Do they do basic healthy things like wear seatbelts, wear helmets when they're riding their bikes or motorcycles, those kinds of things. You also want to evaluate the social determinants of health that may influence the patient's health and wellness. So, any kind of social determinants of health. So what does your patient do for fun? Is it binge drinking every weekend with their friends? Is it sitting around smoking cigarettes all day? What is healthy, and what kind of health habits or not health habits, healthy habits does your patient have that could affect their health and wellness? Okay, development of diagnosis. So you're going to utilize your diagnostic reasoning. And how do you do this? You're going to synthesize and analyze collected data from your health history, from any diagnostic information, any test you ran. You're going to put all of these pieces of the puzzle together to start coming up with different diagnoses of what possibly could be going on with your patient. You're going to look at symptoms. You're going to look at the tests. You're going to look at the history, any results from anything, and you're going to start putting the pieces together. Another big thing is your family history. You're going to want that genogram. You're going to want that three generations of family history from your patient to make sure you're not missing anything in terms of what they might have genetically going on with them. And then you're going to formulate differential diagnoses based on their history and physical and their diagnostic test results and their information. Now, what exactly are differential diagnoses? You're going to hear that a lot. And differential diagnoses are basically, you're going to come up with a probable diagnosis of what you think your patient has based on their symptoms. And then you're going to come up with a bunch of other different diagnoses that it might also be, because you never want to get stuck in a bubble of just, making yourself think, okay, it's definitely this, when it could be a couple of other different things. So you always want to have an open mind as to, if your intuition is leading in one direction, great, but you always want to have a list of other possibilities of diagnoses, aka differential diagnoses. Now, once these steps are completed, the FNP, or the family nurse practitioner, is ready to develop the treatment plan or plan of care based on standards of care, scope of practice, and evidence-based data. Okay, so a comprehensive treatment plan includes your diagnostics, which is your lab work, your x-rays, your scans, anything like that. You want to make sure you follow up and actually get the results of these scans and lab work. Pharmacological things could be including any written or electronic prescriptions or recommendations for over-the-counter drugs. Non-pharmacological interventions could be the use of hot and cold, heat packs, ice packs, physical therapy, diet, lifestyle changes, quitting smoking, healthy habits, exercise, anything that's non-pharmacologic. Patient education would always be included in your treatment plan. This would be considered health. You want to consider their health literacy, like what do they know about their health? What do they know about health in general? And what's their education level? You want to understand their access or fluency with technology, because right now, not everybody has the ability to use a smartphone or has a smartphone, so they don't have access to that information that you may assume they have access to. You want to understand their language, their age, their vision, and what they actually can understand in terms of the approved handouts that you have available for them to educate them. You want to include consultations or referrals in your treatment plan. You want to also talk to your patient about that too, because you really want to make sure they're going to follow up with the consultation or referral. You don't know how many times I've made that recommendation and the patient never follows through, and then nothing changes because, I didn't know they didn't go, and so they're still suffering, and, who knew? So you have to make sure if you're going to send them to a consultation or a referral, you want to talk to your patient about it to make sure they're actually going to be willing to go and follow through with it. And then, of course, follow up with them afterwards to find out what the results of that particular referral or consultation resulted in. And then, of course, follow up. Just like I said, you want to follow up. You want to make sure that patient can, return to see you, or you call them, or you just make sure that they, you tell them when they need to return based on what's going on. And then, of course, you also want to make sure they're aware based on their diagnosis or symptoms when it's important to seek emergent care. Okay, so here's an example of a treatment plan for blepharitis, excuse me. So here we have, in terms of what treatment they included, the pharmacological treatment that was included was erythromycin ointment, apply a thin ribbon to the lower lid 3 times a day and at sleep for 7 days. And what did they dispense? A 3.5 gram tube. Okay, great. What was the non-pharmacological? So the non-pharmacologic was to apply warm compresses 3 to 5 times a day to the eye. Okay, that'll help relieve pain for sure. What else? Consultation, if it reoccurs, If the blepharitis recurs, you're going to want to recommend an ophthalmology referral. And the likelihood is the patient will definitely follow up with that, because if they don't, they're going to not be in a good place. They're going to be in a lot of pain and discomfort. Patient education. Avoid contact lenses until the treatment is complete. You have to wear glasses. You want to discard old eye makeup. Consider hypoallergenic products. And you want to make sure you encourage good hygiene before they go anywhere near their eyes. And of course, you want to make sure they follow up with their primary care physician in 2 weeks or sooner if they haven't improved. And of course, if they develop any significant eye pain or sudden visual changes, they need to immediately go to the emergency room. Now, keep in mind what blepharitis is. It's a chronic condition caused by inflammation of the eyelids, and it's associated a lot of the times with seborrheic dermatitis and rosacea. And the lid of the eye sometimes can be colonized with staphylococcal bacteria. So a lot of the times patients with this particular condition get intermittent exacerbations. They complain of itching or irritations in the eyelids. They sometimes get a gritty sensation, eye redness, and crusting. Okay, so this would be a treatment plan for blepharitis, and it included all of those things we just discussed: pharmacologic, non-pharmacologic, diagnostics, which they didn't need any, consultation and referral only if needed, patient education for sure, and of course, follow-up. Okay, summary of treatment plans. So for FNPs, use this process for each new diagnosis. So it's interesting to me that we put this subject matter within the eye ocular disorders in the same chapter. I think it's really good we did, actually, because one of the most important things with ocular disorders is the importance of a good treatment plan that includes follow-up. Okay, you don't want to leave any ocular disorders untreated or not followed up with, because remember, the severity of what can happen is significant. If your patient loses any of their vision, that will have a tremendous impact on their life. So you just want to make sure that no matter what treatment plan you're putting in place, it always includes follow-up, whether it's for ocular disorders or any disorder, in any realm of issues. So again, for each new diagnosis, what are your pharmacological interventions, your non-pharmacological interventions, your diagnostics, your patient education, your consultation and referrals, and your follow-up. When using problem lists, include whether new, active, resolved diagnosis, and address changes. Each site has their own method of using a problem list. Okay. So self-critique should be a regular part of student and professional practice. Where are you less comfortable? How can you improve? What new resources are needed? Do you need to read about a diagnosis? Do you need to find out what the differential diagnosis could be? And how could you improve documentation? These are all ways to improve your processes as an FNP. Keep in mind, for the first, I think it's 3,600 hours in New York. I'm not sure what it is in Connecticut, but for the first 3,600 hours of your practice as an NP, you will be working under a collaborative physician. And even after that, depending on where you work, you'll probably have a collaborative physician. I, in particular, have a collaborative physician where I work for the company I work for, in which I do wound consultations in different facilities. And my collaborative physician actually just reached out to me the other day because he wanted to do a review of my charts. And I was very excited because I have somebody looking at my charts who's more experienced than me, who can really give me feedback on where I am lacking, whether it's in my treatment plans, whether it's in my documentation, or any of those 6 things that you see above in the processes of my care. So he actually did follow up with me, and it was wonderful feedback. Not all positive. Some of it was stuff that I need to work on, but it's so helpful because I already can see that it's going to make a difference in my treatments going forward, which is what it's all about, and then helping improve the quality of our patients' care. All right, so that's it for treatment plans. Again, most important, just always incorporate this into your plan for your patients. Pharmacological components, non-pharmacological components, your diagnostics, your patient education, your consultations, and your follow-ups. Next, we're going to get into more information on ocular disorders.